Hey guys, it's Dr. Adkins here, and I am coming to you today to talk about a condition named obstructive sleep apnea and why on earth your dentist is talking about it. I will promise I will explain. So first thing I want to do is just tell you what it is actually, and kind of in a gist what it means. Obstructive sleep apnea, a lot of you know what snoring is, which is a partial apnea or partial blockage of the airway. Well, obstructive sleep apnea happens when there's full blockage of the airway as well. So I'll show you an example in this picture. If you notice, this is a picture of a person, kind of a caricature of a person lying down. And if you notice this orange area, this is kind of where the available volume of air could pass through. And if you notice in a normal person, the base of the tongue and the lower jaw and the upper palate and the soft palate, they are off of the back area. They are not obstructing that airway. So normal passage of air can go without being blocked at all. But in a person, for example, who snores, there's the mandible, the lower jaw and your base of the tongue end up dropping back a little bit into the airway space. And so the volume of available volume for airway passage ends up getting limited. And if enough of this obstruction happens to where the passage of air causes tissue to collapse against itself and make sound, that's snoring. And in more severe cases, the base of the tongue and the lower jaw end up dropping all the way back into the airway and fully obstructing that available space. And so there's no passage of air, there's no oxygen coming in, and no CO2 going out. That is a complete obstruction or a complete apneic event. Essentially, that's basically what's happening in an obstructive apnea event, is that the blockage kind of happens from the base of the tongue and the mandible all the way back to the airway, and literally it fully blocks, so you can't take in any air. And I want to show you what that kind of looks like in life, not in caricature form. And if you notice, this is an adult, and I'm going to show you what he looks like. Take a look at this. So he's just about to get blocked. There it goes. So you'll notice in a few seconds he's fully blocked. There's no air passing, and he's going to try to breathe. Notice the belly. Notice that effort. So he's trying to capture air, but because there's a blockage here and no air is passing, his muscles, he's still going through the effort required to breathe. It's just that no passage of air is happening. Now this can happen for many, many seconds, sometimes more than 1 minute, until the brain wakes him up because he needs oxygen. And so he catches his breath for a few breaths and then starts to fall back asleep. The brain goes through its sleep stages, and as he gets deeper into sleep, notice what happens. Those muscles relax again. The back of the throat ends up getting blocked again. He goes through the effort again to breathe, and yet no passage of air can happen, and he'll go through this. Now again, I just want to point out that it's quite a long time. I've seen patients go through this for 90 seconds, 100 seconds, 120 seconds, where there's no air passing through. Hold your breath for a minute and a half or 2 minutes during the day. Just do this first, capture all the air you can, and then hold it for 2 minutes. I want to see if you can do it. The amount of stress is astounding. Now, I don't have to, you don't have to be in a sleep lab to realize how much stress that actually ends up inducing on a patient's physiology, as you might imagine. So between deprivation of oxygen and excess of CO2, because it can't get out. So if oxygen can't get in and CO2 can't get out, both of those things end up causing a lot of problems. Now I want to show you what it looks like when a child experiences this. It's a bit heartbreaking, forgive me, but much the same as the adult. This little baby is trying to breathe. Look at the effort. But again, you can almost hear him choking on his tongue. And again, this goes on for seconds and seconds and seconds. All the way. There you go. Until his brain wakes him up a little bit, so he catches a few breaths. And again, the deeper he goes back into sleep, the more those muscles relax again, and the blockage happens again. And again, he goes through the effort. You can almost hear him swallowing his own tongue right now. Now, adults and children experience the condition differently, and they experience the symptoms differently. So adults during the day, when they've had a terrible night's sleep, which, by the way, that is a terrible night's sleep. You can't oxygenate, you can't repair, you can't get rid of your CO2, you become toxic. This is a terrible night's sleep, and not to mention you're waking up multiple times throughout the night. Even if you're not coming all the way back to awake, where you're aware of your surroundings, you're still leaving the sleep architecture, the deeper stages of sleep, coming up to a lighter stage of sleep, so your muscles can start to activate again, and you can catch your breath. So this multiple arousals throughout the night, awakenings throughout the night, end up leaving adults feeling very tired during the day. Their cognitive function ends up being hindered. For example, they'll start having memory loss problems. They can't remember, where the keys are. They forget to turn off the stove or the lights or the TV. They can't think of names that, of family members readily available, even though they know these people their whole lives. They can't think of them readily available and bring them out and articulate them. That type of cognitive dysfunction happens to adults. Now with children, cognitive dysfunction happens differently. They can't focus. It's the same thing. The adult can't focus their attention either, but with children, when they're overly tired, they end up behaviorally acting out. So they end up ADD, ADHD, they're hyper, they're irritable, they tend to be, in fact there's an actual correlation proven in science between ADHD and obstructive apnea in children. They experience the symptoms a little bit differently. Nonetheless, we have multiple solutions. I want to talk to you guys a little bit about what the various solutions are for this condition, and why on earth your dentist is talking to you about it. So historically, this obstructive sleep apnea condition was treated through medical profession only. And we had, the medical colleagues had come up with various solutions. There was, way back in time, they would do a tracheostomy, and they would go through, and actually you would breathe from down here, and they would just bypass the entire airway system up here. Of course, not convenient for everyday life to have a breathing tube here. So then they came up with a CPAP, something called continuous positive air pressure. It kind of looks like this. This is one example where it's a mask that sits on the face, and it has tubes that go to this unit, this machine, and it produces air, humidifies it of course for comfort. It produces air at a significant pressure that's appropriate for the level of tissue collapse in each person, and it continuously pushes air through, and that positive air pressure helps to keep the lower jaw and the tongue forward and out of that airway space so that it doesn't collapse. That was what we had for many, many years. It is, I have to tell you, CPAP therapy is 100% effective, assuming you wear it. Unfortunately, because of, people have claustrophobia, different people get uncomfortable with the mask, some people don't like the air pressure. For whatever reason, about half of the patients can't tolerate CPAP therapy. So for those people, we still had to come up with another solution. For the other half of the patient base that can actually tolerate the CPAP well, a significant portion of those patients can only wear it and successfully tolerate it for about 4 hours on average. That's considered successful treatment, in fact. So I don't know how many of you can function on 4 hours of sleep. I certainly can't. So we had to come up with augmenting the care with other potential solutions that could be helpful to people. And a few years back, the dental profession ended up getting involved, because if you think about it, even though this is a sleep-related breathing disorder, it turns out it's an oral problem. The tongue and the mandible oral structures are falling back and collapsing the airway in this case. So it seemed like a natural fit for dentistry to try to come up with solutions that may help from an oral perspective, and that's where dentistry, the profession, came up with oral appliance therapy for the treatment of obstructive sleep apnea. Now, I want to show you what different oral appliances look like. Many of you are familiar with oral appliances already. You've had night guards and sports guards. People wear, if you watch hockey and football, they're always wearing some kind of appliance in there. People are used to bleaching appliances. Oral appliances for the treatment of sleep apnea are much the same. If you look over here at these pictures, there's multiples, obviously, many designs. I couldn't fit them all on a wall, but I wanted to show you the basic gist of it, the basic concept. And I'll tell you a little bit. So the basic concept is this. They're usually two-piece appliances, typically two-piece appliances. But the essential concept is that they move the mandible forward, and by doing so they bring the base of the tongue also forward, leaving the airway open no matter what position a person is in. So whether you're on your back or on your side, when the mandible is pulled forward and the base of the tongue is pulled forward, it keeps the airway patent, nice and open. So, but they look different. Everybody's always curious, what do these things look like? They imagine these things are horrible. They're not that bad. They're usually two-piece appliances, and they have different attachment sort of pieces to them that help us control the position of the mandible. Sometimes these areas of control for us are on the sides of the appliances. Other times they're in the front of the appliances. Here's another example of the side. Here's another example of the apparatus being on the side. Here's another one on the side. Essentially, this is what they do. So they go in there and they make these hinge kind of parts to the appliance, and we get these little wrenches, and we can move the piece forward or back as we need to make it so that your jaw ends up out of the airway. Essentially, that's the concept. They're generally pretty comfortable, relatively comfortable, surprisingly. I know that sounds perhaps bizarre, but people sleep well with them. I think by the time you have obstructive apnea, sleeping is such a terrible experience for you, whether you realize it or not, that something that actually helps you sleep better ends up being such a gift. So generally they're pretty comfortable. You tend to get used to them even if they're not initially the most comfortable. And usually they're covered through medical insurance because this is a medical condition. The consequences of obstructive sleep apnea are very, very significant. You may have already, inherently sort of imagine lack of oxygenation is not a good thing for us. We are aerobic organisms. Every cell in our body is aerobic. We need oxygen, and we need to get rid of CO2. So you might imagine already that having less oxygen and excessive CO2, not a good thing for us. Having sleep, normal sleep is essential for humans. The sleep drive is so important that I don't care if you're driving a truck. If you need sleep, your body will shut down. As you've noticed, a lot of motor vehicle accidents and things like that happen, and then we find out later that the person was experiencing sleepiness. Sleep drive is important enough. We need it for repair, for regeneration, and for God knows what else that we don't even know. There's a lot we don't understand about why we need sleep, but we do know this. It's important enough that we spend, as a species, we spend a third of our lifespan in sleep. It's that important to us. Not by choice. It's not voluntary. In fact, sleep deprivation has been used in history as a form of torture. So these people who can't sleep well or can't breathe well essentially are being tortured throughout the night and suffocating throughout the night. It has multiple effects, long-term effects, short-term effects, ranging from cardiovascular disease, things like hypertension has an independent, so blood pressure problems have an independent correlation with obstructive sleep apnea. People have lipid metabolism problems, so they're prone to cholesterol problems when they have breathing difficulties at nighttime. People have cognitive dysfunction, as I mentioned earlier, where focus and memory start to become hazy. People become more prone to depression, to chronic pain, and a whole host of other things, diabetes. It leaves you susceptible to many other conditions, all of which the basis of it is basically oxidative stress. Oxidative stress on the body is very detrimental to the physical form, to the physiology of the human function. So I want to reiterate that this is not just a snoring, issue where you don't feel it, you don't know it. A lot of times people end up having a lot of the consequences before they even realize there's a cause, and it happened to be that they haven't breathed well during sleep for their entire lifespan before they realized why they have all these other conditions. So help us save a life today, whether it's yours or a loved one of yours. And I'm going to leave you with one thing. I want you to stay away from misconceptions. I hear it all day long. It is one of my biggest frustrations. I hear people say things like, oh, but I don't snore. Or my wife or my husband has never heard me. Or I don't hear my child make any noise. Well, I just showed you a couple of videos. One example, the adult made some sound. You heard him go through some, kind of snorting sounds. And then there was silence, significant silence in between. And then I showed you the little child who, if you were sleeping in the next door to that child, there's no way you would hear him go through that breathing difficulty. It didn't make that much noise. So stay away from misconceptions. This does not have to mean that, you don't have to snore like a Mack truck to be experiencing apnea. In fact, by definition, a full obstruction, a complete obstruction of the airway, there is no more passage of air, therefore there is no more noise. So leave it up to us to help you figure out if this is a condition you in fact suffer from. Please don't self-diagnose. The conditions that come as a consequence of this condition are so significant to you and your well-being that it's just simply not worth it, especially when you can either wear a mask and sleep and breathe fine, or you can wear an appliance and breathe just fine, and a whole host of other options that I will talk to you guys over time. It's not worth going through the suffering and the suffocation over a course of a lifetime. So help us help you and your loved ones. We look for signs and symptoms at Adkins Center for Dental Medicine. It's about a third of our practice here. We work with our medical community in the area. We work with sleep labs and sleep physicians and pulmonologists and all kinds of different doctors. We take an approach that is community-based approach to the treatment of this condition as it needs to be. And so I'm here to help you. I can't wait to meet you and your family members. If you suspect that you are suffering from this condition or somebody that you know, don't wait. Don't wait another minute to get a better night's sleep. Thank you very much.